Good evening, everybody, and welcome to our Digital Glaucoma Support Group. And this one is Glaucoma and Eye Drops, the basics. I would like to introduce Kieran Godly, our Helpline Advisor here at Glaucoma UK, who will share his knowledge and expertise on glaucoma and eye drops, the basics. So this will be the main focus for this session. We are enormously grateful to Kieran generously giving up his time to present this webinar and the homework he's done beforehand to put it together. We specifically invite speakers who are knowledgeable on the topic being presented. The information shared tonight is based on their own experience and knowledge and does not replace individual medical advice. Your circumstances are unique to you. We are all individuals. So if you are thinking of making any lifestyle or medical changes as a result of this webinar, please do speak to your eye specialist first. Glaucoma UK are not responsible for any action you might take as a result of the information you learned throughout this webinar. Please don't forget to ask any questions in the Q&A function. Please like any questions you like so we can answer the most popular ones, and we're going to try and answer them all this evening. We've got about an hour today, but if afterwards you need more information or support, we'll touch on that, how you can get it at the end of the hour. We've got an hour. Okay, it's over to you, Kieran. Thank you very much.
Hi everyone, I hope you're all well. As Pete said, I'm Kieran Godly and I'm a Helpline Advisor at Glaucoma UK, and I will be talking to you all about eye drops this evening. Okay, so before we talk about how eye drops work, first we need to just briefly cover what glaucoma is and how it works. I think a lot of previous glaucoma support groups have touched on this too, so I'll try and keep it as quick and simple as possible. But as you will probably know, when we're talking about glaucoma, we're talking about the optic nerve at the back of the eye, because this is the part of the eye that gets damaged through glaucoma. And we want to protect this because this is what's responsible for sending these electrical signals to our brain, these messages, and helping us see. As you all also might be aware, the result of the optic nerve being damaged through glaucoma is a result of the eye pressure rising. When we have high eye pressure, these nerve fiber layers which make up the optic nerve, there's about 1.2 million of them. They are very sensitive to pressure, so they can start to die off if the pressure's too high and uncontrolled. This fluid is being produced by something called the ciliary body. So it says here ciliary processes. We usually refer to it as ciliary body. So this fluid is constantly being produced. And so this is a diagram of the iris, and this is the color part of the eye, flows 360 degrees. And we also have the trabecular meshwork just below the iris. Again, it runs 360 degrees, and this is where most of this fluid will drain from. Around 80% of the fluid drains through the eyes. This is known as the conventional outflow, and then about 20% of the fluid that's being drained through the eye is called the unconventional outflow, which I will touch on later. So glaucoma and treatment options. As I said, glaucoma is the damage that occurs to the optic nerve at the back of the eye due to high IOP, stands for intraocular pressure, but eye pressure is fine. But if you have high eye pressure, it doesn't always mean that you have glaucoma. Some people can have high eye pressure without glaucoma, and some people can have normal pressure with glaucoma, which I'll get into now. Different types of glaucoma, just quickly. Primary open angle glaucoma versus primary angle closure glaucoma. This is what these two abbreviations are here. So primary open angle glaucoma is the most common type of glaucoma. It means it's the open and closed part of the angle is referring to the trabecular meshwork. So if that trabecular meshwork, it can be cut off slightly by sometimes how the iris can bow forward, and it can be due to the shape of the eye and things like that. That's what we're referring to of primary angle glaucoma, angle closure glaucoma, sorry. But open angle glaucoma, it's that trabecular meshwork's open, it's just a little bit clogged up. So if you think of it like a drain, and you have the tap that's running, which is the ciliary body, which I touched on, and then the drainage is, you know, through the sink kind of thing. Narrow angles versus ocular hypertension, these are kind of like precursors to glaucoma, if you like, or it can label someone as a glaucoma suspect. Narrow angles is a precursor to angle closure glaucoma, but you can have narrow angles without glaucoma. The same with high eye pressure, ocular hypertension. I have put here also NTG, this is normal tension glaucoma. Normal tension glaucoma is basically when your eye pressure is in the normal limits, but there is still damage occurring to the optic nerve. So if you think of it like we all have our ideal eye pressures, for some people, the ideal eye pressure is 10 to 21. Some people with a pressure of 15, that can be too high for them, whereas some people can have a pressure of 25 and, you know, not have any glaucoma damage or anything like that. So, you know, it does vary for us all, and we're all different. When it comes to treatments, like I said, turning the tap off is one way to stop so much of this fluid being produced, versus increasing the drainage, so increasing the amount that's flowing through the trabecular meshwork or the unconventional outflow. And also there's also new drainage channels which can be done via surgery, but I won't be touching on them tonight. So what eye drops do and how they work: they lower eye pressure, nice and easy. They can be used for all the different types of glaucoma, really. So normal tension glaucoma, open angle glaucoma, angle closure glaucoma, and ocular hypertension. For some people, if they have a pressure of 25, but you know, no glaucoma, they might be put on eye drops just as a precautionary, you know, thing to stop the risk of glaucoma from happening. The eye drops lower the eye pressure in different ways depending on the eye drop. I'll go through all of them. They can increase via the uveoscleral route. So again, that's increasing the drainage, and that's known as the unconventional outflow, which I'll go into in more detail. And there are also a lot of eye drops that work by turning the tap off, so reducing the amount of fluid that's being produced. And more recently, which I'll go into, there's something called Rocklanda, which you might have heard of, which is the first drug in a long time that increases the outflow via the trabecular meshwork. So first of all, prostaglandin analogues. You all have probably heard of them or used them at some point. They're usually the one that's first prescribed when you're diagnosed with glaucoma or high eye pressure. You might also know them by the names of latanoprost, travoprost, and tafluprost. You might have also heard of bimatoprost. It's a prostamide, but it still falls in a prostaglandin. It's just their chemical structures are just very slightly different. So prostaglandins work by increasing the outflow through the uveoscleral route. So again, this uveoscleral is the unconventional outflow. So we're not talking about the trabecular meshwork here, okay? Uveoscleral is basically uveal plus scleral, and it's broken up. Uveal means the fluid in the eye flows from the space between the sclera and the choroid. So the choroid is the bit between the sclera and the retina, and the sclera is the white part of the eye. Okay, so the outside of the eye. So it's a very, very thin layer, so it kind of flows through down here somewhere. And then scleral means it basically just seeps back into the lymphatic vessels outside the eye, and it's just, you know, reabsorbed and etc. That's just a continuous process. As I said before, about 20% naturally drains through the uveoscleral route, and prostaglandins aim to increase the amount that's flowed through the uveoscleral route. Branded names of prostaglandins you also know, or might also know of, are called Xalatan, Monopost, Lumigan, Travoprost, and Tafluprost. Beta blockers next. Beta blockers work by turning the fluid, the taps off, if you like, so it stops so much of this fluid being produced by the ciliary body. You might have heard of them known as Betagan, Betopic, and Tiopex, and these are the active drug ingredients below as well. Timolol is the most common, I would say, because it's slightly more effective than the others. You can have selective and non-selective beta blockers. Non-selective is timolol, so non-selective is slightly more effective, but selective are generally safer in terms of side effects. They're both safe, don't get me wrong, but non-selective, you might notice some more side effects of some people with asthma and things like that. It can be a real problem. Usually used 1 to 2 times daily. Next, we have carbonic anhydrase inhibitors. These again work by turning the tap off, so very similar to beta blockers, but I've just said here beta blockers versus carbonic anhydrase inhibitors. They kind of have different mechanisms, which is why they can be used in a combination drop. So you might think, well, they're doing the same thing, why would I be given both? But they can work in conjunction with one another. You can have both topical and oral carbonic anhydrase inhibitors. So the oral ones are known as acetazolamide, and then the others are topical. So again, come in the form of eye drops. The eye drops are also known as brinzolamide and dorzolamide, and then these are some of the branded names here. So Azopt, Diamox, and Trusopt, which you might have heard of. Can be used 2 to 4 times daily, but the 4 times daily is usually the acetazolamide. Next, we have alpha-2 agonists. They reduce the amount of fluid being produced by the ciliary body, and they increase the drainage through the uveo-scleral route. So they turn the tap off and increase the drainage. You won't find an alpha-2 agonist used in conjunction with a prostaglandin because they're doing very similar things, but you can have a alpha-2 agonist with like a beta blocker or something like that. Also known as alphagan, brimonidine, and iopidine, used 2 to 3 times daily. And then you have something called parasympathomimetic eye drops, also known as pilocarpine. It's not used as much anymore, but it does increase the conventional outflow through the trabecular meshwork. So it can be given as a treatment for angle closure glaucoma, as it can make the pupil smaller. And when the pupil's smaller, it reduces so much of this trabecular meshwork that's kind of being made narrow by this dilated pupil. It's not used as much, as I said, because it's needed so much. So 4 times a day, and for those of you using eye drops, it can be hard to remember to use them, every night, let alone 4 times a day. So it can be quite strenuous on the person using it in terms of remembering when to do so. And they can cost more. I'm pretty sure in the US they can cost more. So I think in the UK they might as well, but I'm not 100% sure on that. But if there's other drops that work so much or work well as well, you can probably see why a consultant would lean towards not using them. They can come with some intolerable side effects as well sometimes. Lastly, Rho kinase inhibitor. This is newly licensed in 2023, and this is what I was referring to a minute ago when I was talking about the new eye drops that they have brought out. It's known as Rocklanda. It's a combination of latanoprost, which is a prostaglandin, as I mentioned, and it's also it's combined with nitasidil. And nitasidil is the part that increases the drainage through the trabecular meshwork. So it's reinforcing that conventional outflow. First new treatment in the UK for 25 years, so it's quite promising for those who have exhausted all their options of eye drops, and it's just kind of another, bullet in the chamber really when it comes to treating glaucoma and trying to control it. So yeah, and usually used once daily as well. So combination drops, I'll go through quite quickly. So combination drops are basically to stop you having to use 2 drops separately. They combine it into one, so you only have to use it once, and it's a lot easier for you when you are having to do so. So you can have alpha-2 agonists and beta blockers, also known as something called Combigan, you might have heard of. That's the brand name, which is brimonidine and timolol. I've put them all below here, as you can see. Can have a carbonic anhydrase inhibitor and a beta blocker, and also a carbonic anhydrase inhibitor and an alpha-2 agonist. You can also have a prostaglandin and a beta blocker as well, like something called Ganfort you might have heard of. It's quite a common one. And lastly, you have letanoprost and letacidil, which is Roclanda, which is what I just touched on in the previous slide. Side effects, very tricky when it comes to side effects, as we can all react differently, but unfortunately, with any drugs, this can happen. With prostaglandins, it's often more localized, so often what I mean by that is that it can affect the eye directly or happen around the eye itself. It can cause things like longer lashes, darker circles below the eye, darkening of the eye color, so the iris. If you have, like bright green or bright blue eyes, that can have an impact on their kind of vibrancy. It can cause sunken eyes, and more rarely it can cause sometimes like swelling of the macula and things like that. I think prostaglandins are usually the one that people are quite hesitant to use because it can change your identity, or people feel like it can change their identity and things like that. So it can be quite stressful using them. Beta blockers can cause more systemic side effects. So like timolol, like I was saying earlier, it can cause things like a slower heart rate, difficulty breathing, and low blood pressure. If you're using a beta blocker tablet and already getting side effects from it, some consultants might be hesitant to add that beta blocker on top, that eye drop, because that can sometimes make the side effects worse, unfortunately. Carbonic anhydrase inhibitors can cause stinging, but that doesn't mean it's harmful. But some people can say, it really does sting when it goes in. It can also cause like a metallic taste in the mouth, and also an allergic type reaction around the eye, like a dermatitis type reaction. And acetazolamide, which is the oral tablet that I was telling you about as well, can also cause side effects. I've spoken to some people on the helpline where it's been quite stressful for them taking acetazolamide because that it can cause some really nasty side effects for them, unfortunately. But as I said, we all react differently. Alpha agonists you can develop like an allergy, and this can also be delayed. So if you start using a drop or an alpha agonist, and then 3 months or so later you start developing a reaction and thinking, what is this? I was absolutely fine using this. That can be the culprit, so it's worth investigating if that's you. Can also cause things like fatigue and dry mouth. Parasympathomimetic, so again, pilocarpine, can cause headaches and also darker vision due to decrease in the pupil size as well. Punctal occlusion and ocular surface disease. So punctal occlusion is basically the process when you put the eye drop in, you lightly hold the bridge, you lightly press on the tear duct in the corner of your eye. So it's just on the bridge of your nose in the corner of the eye, just there. And if you press on that really lightly, that stops so much of the eye drop kind of getting to the back of the throat and into the bloodstream and causing these side effects. If you get side effects still, and it can happen because punctal occlusion is not going to stop all of the eye drop getting, down the back of the throat and things like that. But if you're already doing the punctal occlusion for a minute or so, you might want to increase it to maybe 2 or 3 minutes just to hold it that a little bit longer, just to stop, see if that helps, because for some people it can, just doing it that little bit longer. I've put here dry eye is the most common side effect, unfortunately, because these eye drops have chemicals in them, and they need chemicals in them to be able to get into the eye and do their job, basically. Sometimes it can be the preservative itself, so sometimes people can have an allergic reaction to the preservative, which, you can get preservative-free eye drops for them, but sometimes that's not enough. Due to the chemicals, it can still cause quite bad dry eye. Some things that can help, like I said, preservative-free options, branded versus non-branded options. So sometimes the branded eye drop, so when an eye drop manufacturer makes a new eye drop, they have a patent on this eye drop that will last 10 years, and when their patent expires, other companies can start manufacturing that eye drop too. So we had something called Xalatan for latanoprost, but their patent has run out, so we get all these different brands now of latanoprost. So sometimes if you were to use a branded one instead, that can improve your dry eye because they have kind of more stringent, I guess, tests that they have to do and to make sure the pH is correct and things like that. Heated eye masks can be really, really good and provide a lot of relief for dry eye, just 5-10 minutes in the morning or evening. It can stimulate the oil glands in the eye and keep the eye lubricated and things like that. I've put here as well autologous serum eye drops. So these are serum from the blood, from your blood plus saline, and then they make them specifically for you. So that can be a good option as well. Punctal plugs if you have really teary eyes, because dry eye isn't always making the eye dry. It can also cause an increase. It can also make the eye watery and cause excess tears and things like that. So punctal plugs can be a good treatment for that. Lubricating eye drops, a really good option to use alongside your glaucoma drops. Just leave that 30-minute gap between the glaucoma medication and the dry eye medication to make sure the glaucoma medication is fully absorbed. Eye gel to be used at night is quite thick, so it can cause, naturally, because of the thickness, it can cause a temporary blurring of the vision. Lifestyle factors worth mentioning, things like omega-3s, hydration, things like air humidity and things like that. Changing eye drops if you've exhausted all of these, if and a drop is still causing these effects, if changing an eye drop could be the solution for you. And alternative treatments as well, like surgery and laser. For some people, they really can't get along with eye drops whatsoever. They can't do it because of side effects and things like that, where surgery and laser might be considered. I've also put here a little bit on steroid eye drops. Steroid eye drops can increase the pressure in the eye, unfortunately, because it can cause changes in the trabecular meshwork. It's sometimes needed, like post-surgery or in other eye conditions like uveitis. As I said, changes in the trabecular meshwork. And also, if you don't have glaucoma already and you use steroids, it can cause steroid-induced glaucoma, which is a type of secondary glaucoma. But it will depend on how long you're using steroids for. So you can have kind of reversible effects of steroids and irreversible effects, which is when you get to the, like steroid-induced glaucoma stage. Compliance, very important, because if you don't use the eye drops, they won't work. Some things like remembering to take them in the evening or in the morning or throughout the day, can be difficult. Especially if you're using them multiple times a day. Things like side effects can stop people from wanting to use them because it's causing them a lot of distress and other problems that they didn't have before. Traveling, if you're traveling abroad, some people want to stop using the eye drops altogether, which you shouldn't do. And they can also worry about storage conditions or time changes when they go abroad and things like that. Unable to open, aim, or squeeze the eye drops, which I'll get onto. We have a number of dispensing aids, which are basically a very good solution for this. If the eye drop stings, so again goes with side effects, but sometimes that can be enough to stop people from wanting to use it. and lifestyle factors as well, which goes hand in hand with remembering to take them, but things like evening plans or work and things like that can be hard to remember. So dispensing age, just quickly, I'll rush through these. And if you would like more help on this, then by all means call the helpline and we can advise you on the best option for you. They're all listed on our website as well. First of all, the auto drop. It will help. It's great to help you aim the drops, but not great to help you squeeze the drops. But if aiming is your problem, you know, for me with eye drops, I struggle with aiming them as well. So this is a good solution. It goes over, the oval part goes over your eye, and it helps to secure the eye drop in place and make sure you get it into the eye, and not miss and get it down the cheek and things like that. Complice, this is very, very specifically made for a type of eye drop called high-low eye drops, which is a dry eye drop. So these two parts go over the eye. Oh, sorry. These two parts go over the eye. The pointy part, the nozzle, it's quite a long nozzle, goes through this hole here, and then it again helps you stabilize and gives you that extra support to help you push the bottle. Opticare, this cylinder kind of opens up, the bottle slots in. You can see a tiny little circle here. It slots into there, and it comes with two little collars to help you secure into place. This kind of rectangular part helps to squeeze it, and this part is the part that goes over the eye to help you aim it. The eye guide, very, very similar to the Opticare, but it is made for the preservative-free options of the multi-dose bottles, I should say. So this is things like Codimaz or Ilamdo or IEs and things like that. It's the ones with the flat top with a little kind of blue bump on top. Arthro 5 and Arthro 10. Bottle goes in this part here, so this part opens up. Bottle goes in, and then the two levers to help you squeeze it as well. These are kind of a riskier option, but some bottles we have tried, especially the branded versions, so it can be good to know. You know, sometimes we know it will work, so we'll always need to know the type of eye drop you're using and brand names for those reasons. Teo IOT, so it's made for these types of individual vials. Again, you take this little cap off, slots in there, and then this is the part that goes over the eye to help you aim it as well. There's a little push part here to help you squeeze it. Finally, actually not quite finally, the universal IR goes through there, only works for specific types of bottles. We don't send it out as much, but it can, it is being discontinued, unfortunately. And then finally, the bottle opener. So we have the universal bottle opener here, but again, that's been discontinued. So we have this new bottle opener, which we've started to send out, which helps you just grip that eye drop bottle a little bit better and gives you that little bit of flexibility to open it. And that's that.
Thanks, Kieran. Kieran, that was great. Very, very insightful and really useful information. We've got lots of questions coming in, no surprise. So we'll go through them and hopefully we'll get through them all. I'd just like to introduce myself. My name is Peter Holt and I'm the Training and Engagement Officer covering Northern England for Glaucoma UK. So the first question, Kieran, if I put 2 eye drops instead of 1 in, either by mistake or because I'm not sure the first one has hit the eye, is that a problem? Does the excess just overflow?
Yes, the eye has a pocket and it can only hold a certain amount of eye drops. So if you use too much in one go, you know, it will just wash out, or it should just wash out, and you'll probably notice it run down your cheek. But if you wait 5 minutes in between the two, I wouldn't do that, because then it can, you know, you'll be getting a double dose then.
Great. Thank you. Next question. Can diet help? Are there specific foods which will help or should be avoided?
Diet can help with eye health, but maybe not so much glaucoma itself. I mean, there's certain things that can help with eye pressure, things like avoiding smoking, alcohol, and excess caffeine and things like that. But adhering to a healthy, balanced diet is our best suggestion at the moment because there's no kind of particular foods which can help glaucoma itself. There's nothing to treat it.
Great. Thank you. Next question. Does it matter what time of day Ganfort drops are used?
Yes, so Ganfor will be need to use once daily as prescribed. So it has bimatoprost, which is a prostaglandin, which is usually used in the evening, and timolol, which is usually used in the morning. So it's up to your consultant what time of day, but it doesn't really matter as long as it's used the same time every day.
Great. Thank you. Next one. I started getting optical migraine, weird angular shapes blocking vision. Is there a link with glaucoma?
Maybe not glaucoma, but it could be a side effect of the eye drops. So it might be worth having a read of the patient information leaflet and also letting your consultant know to do any further investigations if they haven't already.
Fantastic. Great advice. Right, next one. Recently, I was given a generic substitute for Ganfort and the bottle was difficult to use. Can I request a genuine Ganfort from the pharmacy?
Yeah, you can do. They might give it to you if they have it in stock, because that might have been the reason you got a generic. You could also speak to the GP as well because they could write a specific prescription if they haven't already for Ganfort, because then the pharmacist, they have to give you that. But it's worth asking them because sometimes they can.
Great, fantastic. Thank you. Next question. Does Xalatan need to be kept in the fridge? It is very inconvenient.
Usually, Xalotang needs to be kept I believe it needs to be kept in the fridge until first opened. Usually that's the case with latanoprost, but then it's okay to be kept out of the fridge. But please check not patient, section 5 of the patient information leaflet, and all the storage instructions will be there.
Fantastic. I am on brimonidine and dorzolamide for NTG twice daily in both eyes. I believe you said you're not normally given both.
No, you can be given both. It was there's no combination drop of prostaglandins and alpha 2 agonists, but you're on an alpha 2 agonist and a carbonic anhydrase inhibitor. So it's a little bit different, and yeah, that's fine.
Great. Okay, thank you. Next question. How does the clinician evaluate if the eye drops are actually lowering eye pressure? The IOP is typically taken every 3 months, and we know that eye pressure can vary throughout the day, let alone an infrequent visit to get the reading. Without buying an expensive home monitor, what are the different evaluation methods used to determine effectiveness of the various eye drops available?
It's a very good question because well, you might not know, but pressure can fluctuate naturally throughout the day.
Yeah,
It's kind of a hard question to answer, to be honest, but I would say it depends what your pressure was before you started the eye drops. If it was 18 or something like that, and it's come down to 12, that it's likely that it's working because 18 could go higher or lower and 12 could go higher or lower. So that's kind of a good reduction in eye pressure. But if it was 16 and now it's 14, maybe it's not working as well as, that they'd hoped. But it's a very good question and it is hard, it's difficult.
sure. Thank you. Right, next one. I measure my blood pressure quite frequently. Should I wait a while after taking the eye drops?
I don't know, to be honest. Probably a good question for your consultant, but I would say it wouldn't matter, maybe unless you're using a beta blocker. But yeah, sorry, I don't think it would matter. I'm not 100% sure on that one.
Okay, ask the consultant. I agree.
Yeah, yeah,
Fantastic. Next one. We're on our 10th question. We've only got about 10 more to go or so,
oh,
but they
good,
keep
yeah.
coming in, which is great. How can I make squeezing the eye drop bottles easier? I have arthritis and grip and squeeze,
Yeah.
cannot grip or squeeze the bottle properly.
Yeah, so like I said, dispensing aids are your best bet. Unfortunately, this can happen for a lot of people. Like the ones I've just gone through, or give us a call or an email and we can help as well. But like I said, they're all on our website. But that's the best
Wonderful.
bet.
Thank you. Great. Next one. Will preservative-free Roclanda become available anytime soon?
Good question, and I have no idea, I'm afraid. I don't know what these manufacturers are doing. And they don't tell us until they're ready to do so, so I'm not sure, I'm
Until it
afraid.
happens.
Hopefully.
I appreciate your honesty with that one. So, next question about Roclanda again. Does the Roclanda drops increase eye flow, did you say? And what is netricidal? Thanks.
So it increases drainage through the trabecular meshwork. So that part I said in the eye where 80% of our fluid naturally flows through, it's increasing the drainage through there. Okay,
Excellent.
and Nitacidil is the part that does that. So Nitacidil is the drug that works by increasing the drainage through the trabecular meshwork.
Okay, fantastic. Thank you. Next question, Kieran. Do the eye drops have any long-term effect on the vision? Will I need more frequent visits to Specsavers?
It shouldn't affect your visual acuity, so it shouldn't affect, your long or short distance. It can affect dry eye, so it might cause like blurred vision and things like that and other visual disturbances. But it shouldn't require you to go to the optician more, no.
Okay, that's great. Right, next one. I take Lumigan and Timolol in one eye as the other eye had a trabeculectomy, but they have caused a very red eyelid, very obvious compared to the other eyelid. Why does this happen, and is there anything I can do?
It could happen naturally as a side effect. Maybe you're particularly sensitive to one of the eye drops. What that one is, I don't know because, like I said, we do all react differently, I'm afraid. So it's kind of a case of getting to the bottom of that and then speaking to your specialist and maybe trying a different drop. But it's a hard one.
Great. So speak to your specialist again. Next question. Why are there repeated supply issues with Fixaprost? Post?
Like it depends if it's a, manufacturer or a wholesaler issue, I'm afraid, and I don't know. I mean, if it's still ongoing, please do contact us and we can always contact the manufacturer on your behalf and see if we can do some digging for you.
Okay, great. Next question, a quick one. Can you buy the Thea IOT and where?
I don't know if you can buy it, to be honest. You probably can online, but we give it away for free, so why buy it when you can have that? Just give us a call
Absolutely.
or an email, as I say.
Fantastic. Call Kieran. Next question. As acetazolamide is a form of diuretic, will this mean I have to increase my fluid intake?
I don't know. I don't think so. Maybe slightly, but not that I'm aware of. And unless your consultant says to do so otherwise, or it says in the leaflet maybe, then no.
Okay, great. Next question. Which dispensing aid is best?
Depends on the type of bottle, I'm afraid. It really is all different. And as I said, we've tried a lot of bottles, and sometimes even we don't know. So it's sometimes a bit of trial and error.
Okay, great question next. What is the maximum amount of eye drops my consultant can offer before they suggest alternative treatments?
So they can try. So there's five main categories. So well, yeah, five main categories. So prostaglandins, beta blockers, alpha 2 agonists, carbonic anhydrase inhibitors, and urokinase inhibitors. If you can try them all, you can be put on all of them if your consultant wants to. And if you don't want surgery or can't have surgery or are at risk of, something going wrong during surgery, then they can just keep trying until they can make it work. But sometimes there's a, point where we need to consider other options.
Okay, great. Next one's a long question, Kieran. I've been using bemetoprost for a couple of years now, and I've just discovered this has caused such severe dry eye that I haven't been absorbing the drops properly, and my pressures have risen. However, in the last 3 weeks, I've been using lubricating drops frequently, and my pressures have now reduced.
Oh,
I am now
interesting.
being put back on latanoprost, which I used until they no longer seemed to work, and I was put on bebataprost. I'm hoping that my new regime of lubricating drops, the latanoprost, will work well and my pressures won't rise. But I haven't until tonight heard of Rho kinase inhibitor drops, and I haven't been offered these. Is this something I should ask for?
You absolutely can. I mean, I don't know if you've been on other eye drops like beta blockers or alpha 2 agonists or not, but if you're, you could have Rokia's inhibitors because it has that latanoprost anyway. So, because if you're fine with latanoprost, you could use Natacidil as well. So that maybe that Rocland is a good option. So it's worth asking, yeah.
Ask. Ask the question. Right, next question. I'm asking the questions. I know that monopause needs to be taken at night. Any specific time?
No, just before bed at the same time every night. If you do it at 9 every night, keep it at 9 every night. Don't start doing it at 8, then 10, then 7. Keep it consistent because these drops they start wearing off after the 24-hour window.
So stick to the time. Fantastic. I find it harder to feel if the drop has gone in warmer weather. Is it okay to keep them in the fridge or at a cooler temperature?
Yes, absolutely. Yeah, not a problem at all. It's only if your drops need to be kept in the fridge and you don't keep them in the fridge, that's a problem. If they don't need to be kept in the fridge, you can keep them in the fridge. It's the heat that's a problem, not the cold.
Great. Thank you. Great advice. Next question. Which brand of eye mask would you recommend?
There's so many. There's not a brand I can recommend, I'm afraid, but I would recommend checking in Boots or a pharmacy or Amazon and things like that, that they're readily available, and maybe read some reviews or ask the pharmacist or something like that. They'll have some
Okay.
good insights.
Right. There's lots of brands available.
Mhm.
Right. Is SLT worth doing? Uh, s- and would this be an alternative to eye drops? What is SLT, Kieran, firstly?
SLT stands for selective laser trabeculoplasty. It's a type of laser treatment which nice guidelines now state, new patients should be referred for straight away. What was the actual question? Sorry, Pete.
Is it worth doing? And
Is it
would it
worth
be
doing?
an alternative to eye drops?
It can be, yes. It can be to both of those, so it can be worth doing and can be an alternative. For some people, it can work brilliantly. It can work up to 5 years, it can work really well. For some people, it might not work at all. The success rate's just below 80%, so, it's highly likely it will work. Whether it works enough for you to come off eye drops, I don't know, we're all different. But because it's a non-invasive laser treatment anyway, what have you got to lose if it doesn't work really? So
Sure.
it can be a good option to try at least, yeah.
Excellent. And it can always be repeated as well,
It
can't
can,
it?
yes, yeah.
Excellent.
Usually no more than 3 times, but yeah.
Great. Next question. Does vitamin B12 help?
Um, it could help for general eye health probably, but it's not, I wouldn't say it's a treatment option for glaucoma or eye pressure. I mean, they are trialing vitamin B3, but not B12, because there's some early evidence that it can be effective, but I wouldn't say B12 is kind of a treatment for glaucoma.
No. Thank you. Right, next question. What if I forget to put my eye drops in? Can I put them in later or just leave it till the next day?
I would say it depends when you forget. If you use them at 7 o'clock every night and you remember at 9 o'clock that night, use them. If you remembered at 5 o'clock the next day, then no, I would wait for your next dosage.
Okay, thank you. Next one's kind of related. I know that eye drops can be taken as and when, but can you be more specific? How many times?
How many times for the eye drop? I presume that's saying.
Yes, I think so.
It depends on the type of drop. And they do need to be kept consistent. Usually your eye specialist will write on the prescription use once in the evening or use twice per day. If it's twice per day, they need to be used every 12 hours because, like I said, these drops can start to wear off. So, we don't want to get past that 12-hour limit and the eye pressure starts to increase.
Sure.
So just keep it consistent, and that's my best advice.
Excellent. Thank you. What time gap should I leave between using my drops, as I am on 3 different types of drops every night? So the time
Uh,
in between taking different eye drops.
5 to 10 minutes for different glaucoma drops. If it's a dry eye drop that you're using at the same time, I'd use it half an hour before your glaucoma medication. But if you're doing 3 glaucoma medications in a row, I'd leave 5 to 10 minutes between each.
Great. Excellent. Thank you. Next question. It's a long one. Brace yourself. I've developed a skin allergy around the eye, although the eye itself is unaffected. This started after Alphagan was prescribed and has now been switched to Lopodine, but the rash is still there. I've been on latanoprost and dorzolamide or timolol for 2 years with no problem. The Alphagan and Lopodine are more recent, over the last 6 months. I'm on all preservative-free drops now, but not really making a difference. Could it be a delayed reaction of the dorzolamide or timolol or the latanoprost? That's a
Uh,
tricky one.
yeah, it could be. I don't know. It's a hard question because we just don't know your circumstances and things like that. I would say again, it's a question to speak to with your specialist. It might be worth, trying a different drop and coming off a drop to see if you can find the culprit, if you like.
Sure. So
Um,
have that conversation with your specialist.
definitely, definitely, yeah, yeah,
Fantastic. Great. Okay, we're getting there. The last 4 questions. I'm on Cozopt, Alphagan, and Lumigan.
yeah.
Are any of them harmful when trying for a baby?
I'm afraid it's not something we're trained to answer. It's something for the specialist because all medications, as far as I'm aware, can be a problem for
Sure.
trying for a baby. So
So
unfortunately,
it's
I
talk to
can't
your
answer that.
consultant again.
That's the specialist question, yeah.
Excellent. Fantastic. Thank you. Right. Is there a best piece of equipment to measure IOP? My specialist used a handheld pressure monitor, but my optician uses a desk-mounted machine.
Yes, so the handheld one might have been the Goldman tonometer, which is kind of the gold standard. Um, But they're all accurate. They all measure it really well. It's just you might get a more precise measurement with things like a Goldman tonometer. So they will all work though.
Right. Okay. Right. My vision continues to deteriorate at a pressure of 15. 15. I'm on 4 sets of drops a day, but my consultant is reluctant for me to use acetazolamide, but
Yeah,
I do in order to reduce the pressure even more.
yeah.
What is a dangerously low pressure?
Dangerously low pressure. It's like I said, we all have our limits. It kind of goes back to that thing. For some people, a pressure of 2 can be too low. For some people, a pressure of 4 can be too low, but we're talking probably under 5. But usually they don't give acetazolamide long term. They only kind of use it to get the pressure down quite quickly and in the short term. So that might be why they don't want to use it, um, you know, as an ongoing thing, maybe, I'm guessing.
Sure. Great. Okay, the last question. I think it's a fantastic question to finish on this evening, Kieran.
Yeah, go on.
Why are the bottles so small?
Well, good question. Um, all the manufacturers can make their bottles in whatever shape and size they like, I'm afraid. And we have no control over it, but we do sometimes work with manufacturers if we hear they're a problem or if we hear it's an ongoing problem. Um, Unfortunately, it depends. But like I said, it goes back to dispensing aids, really. If you can't use a bottle because of its size, just give us a call, email, or whatever, and we'll find something that can help usually. But if not, we
Fantastic.
always have other suggestions as well.
There's always a solution at our helpline.
There is indeed.
Right. We've finished off with some lovely comments here instead of questions. And thank you for all the questions, everybody. And thank you, Kieran, for all the answers and advice. The 3 comments here are, thank you, Kieran, very helpful.
Oh.
Really helpful session, many thanks. Thank you, this has been very informative. So,
good to hear.
Wonderful. So I'd like to thank Kieran very much and tell you when the next 2 Digital Glaucoma support groups are. And they're on the 7th of July from 7 o'clock till 8 o'clock. And that's glaucoma and cataracts is the topic. And it'll be a clinician and patient perspective. And then in August, we're going to have a general Q&A with a consultant ophthalmologist, which is the 5th of August at 7 o'clock. So a massive thank you to Kieran. And just a reminder that your circumstances are unique to you. So if you are thinking of making any lifestyle or medical changes as a result of this webinar, please do speak to your eye specialist first. I think we've said that a few times when we're answering the questions. Glaucoma UK and the speaker, Kieran, are not responsible for any action you might take as a result of the information you have learned through this webinar. If you do have any other questions that you would like to ask related to glaucoma, please give the helpline a call or drop them an email. The number for the helpline is 01233 648170, or the helpline's really easy to remember. It's helpline@glaucoma.uk. Thank you very much, everybody. I hope you have a fantastic evening, and I've got something from tonight's session. Enjoy the rest of your day. Thank you.
Thanks, everyone.